We've won!
They walked out. They stood firm. And now they've been offered a pay deal. Nurses, paramedics, call handlers, porters and more all wanted the government to listen, and it seems finally they have.
This agreement rightly recognises the fantastic work that our NHS workers like nurses, midwives and paramedics do, whilst also being affordable for the taxpayer and allowing us to deliver on our promises to halve inflation and cut NHS waiting lists.
The government's offering staff in England a one-off lump sum for the previous year. It'll be worth £1,600 for workers such as porters, cleaners and healthcare assistants, around £2,000 for nurses, paramedics and midwives, and nearly £4,000 for the highest paid. A 5% pay rise is also being offered for next year.
You said you wanted an inflation-busting pay rise. Have you done everything you can? Is this the best you can do for your members?
I'm confident that at this stage we've wrung everything out of the coffers that we possibly could, and that's a significant shift in the Treasury position. If you think about what they were saying back as recently as February.
What I can do today is look at the members in the eye and say, after 3 weeks of intensive talks, we now have finally an offer that we can put to our members.
And it will now be put to tens of thousands of union members. Jason is one of them. He's pleased there's finally a breakthrough.
I feel immensely relieved. No one wants to take industrial action. We're relieved that the government have finally taken us seriously. I do believe now that they've seen the resolve of all the NHS workers through the industrial action and are now starting to understand the pressures that we face.
There may be an offer, but it's taken 3 months to get here, and disruption has been huge, mainly for patients who've had their operations postponed or cancelled, and hospitals which are under immense pressure. But it's not over yet. Junior doctors are not even in negotiations with the government yet.
This is very good news after what has been very damaging industrial action. We hope that the government can also enter negotiations with the junior doctors. But there is a question mark, and that question is, how is this going to be paid for?
It is indeed a question many are asking. Without new money, there are fears it'll simply come from elsewhere in the NHS budget, affecting patient care.